Hey everybody, welcome back. My name's JT. I am Nurse Johnny T, coming to you to talk to you today about RSV and when does it become a concern. RSV is hitting us here in the United States, getting ready to start ramping up, and we're going to have lots of kids. So let's dive in. We're going to talk about what it is, who it affects, how it works, and then what do you do about it, the now what section on here. So let's go into the what it is. What is RSV? So it's a crazy little acronym that just stands for respiratory syncytial virus. The big thing that you have to worry about with kids is that it causes bronchiolitis, and we'll dive into the bronchiolitis here in a second. But RSV, anybody can get it, and then we'll dive into that in a second. Sorry, I'm kind of jumping the gun here. Okay, we'll come back to that. So what is bronchiolitis, you might ask? So bronchiolitis is an inflammatory process. This really affects the kids. It causes lots of snot, lots of mucus just coming out there, and then they can go into respiratory distress. Other viruses can also cause the bronchiolitis, so it's not just limited to RSV. So think of like adenovirus, parainfluenza, those ones like that. Any of your cold viruses can cause it. So RSV is more or less a cold. And then in the adult world, it will present as a cold. In little kids, it presents as bronchiolitis. And then we'll talk about kind of what do you do with the bronchiolitis and how do we treat it and stuff. But essentially, there's lots and lots of snot that comes from it. And think about it with the little kids, they have such small airways. So then if the snot builds up into there, it's going to make smaller airways. And that's what's going to cause the respiratory distress. And that's where these kids can get into trouble. So now that we know what RSV is, let's go into who does it affect. The primary ones that you'll see bronchiolitis in is the infants and the toddlers. RSV, like I said, does affect everybody all the way from birth to death. The older population, everybody in between can get it. So there's not any really, that's just like the news makes it a big deal in the media, because it does affect the kids, and there are kids that do unfortunately pass from it, but usually those are your chronic kids that have other underlying issues. Majority of the kids will do totally fine with this as long as they are treated appropriately and get all that snot out, because that will end up blocking their airway. So if we go into the infants here, they're the ones who will get it the worst, just because of those small airways. The motto that we use is rest is best. They used to do albuterol to kind of open up the airways. Some places will still do that. The studies show and the evidence shows that that's not necessarily the best thing, because what happens is if you open those airways and you have lots of snot and the kids are sitting up, even if they're laying down, when I open those up with albuterol, the bronchodilator, where does all that snot go? Right. It drops down even further down, and then it causes worse problems. Then you can start getting into problems like pneumonia, anything like that. So really the best thing to do with these kiddos is suction. There is a fine balance though between too much suction and too little suction. You want to suction enough so that way they can breathe, and then you want to not suction too much, because if you aggravate those airways more, you just cause more inflammatory processes and create more secretions, which causes more mucus, which causes more problems, and then they deteriorate. So when they're presenting to you, a lot of these kids will just have snot pouring out their nose. They might have some retractions, and then they're working really hard to breathe and kind of headed towards that respiratory distress, possibly even towards respiratory failure. And that's what we don't want. And that's why we say suction. I will give parents the nose frida. Nose fridas are super great and super helpful. So that way they can do it at home. Bulb suctions are great for when they're brand newborn babies. Once they're past about a month, 2 months old, they need to switch to a nose frida. Those bulb suctions are not going to be powerful enough to pull out enough of the mucus out of there. The one thing I love that I have in my facility is the wall powered suction, and those ones are great because I can get lots of snot out, and that really helps slow their breathing down, and just opens up those airways. The other thing with these kiddos, make sure you treat the fever if they have a fever, because it's only going to make them breathe faster, which creates more inflammatory processes and then also causes more mucus, and we don't want that. All right, so anybody can get it, okay? So just because the news is like, oh, RSV's hit us hard and it's killing all these kids, blah, 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 I guarantee you've got it too. If you've got a cold and your son or daughter was just diagnosed with RSV, you've got RSV. All right. It's a cold virus is all it is. It is not meant to scare anybody. It shouldn't scare anybody. It is simply a cold virus. The crappy thing is the little kids with the little airways get all that mucus in there, and that's what causes problems there. So, all right. So how do you get it? How is it spread? How do colds get spread, right? It's just contact with someone else who is sick. Somebody could just cough into their hand and then turn around and grab a handle. I go grab that handle and just wipe my face. Sorry, I was about taking my microphone out there. I wipe my face. Now I've just exposed myself to that virus. Somebody coughs or sneezes on me who's sick, I'll get the virus that way. If I'm within contact of taking care of sick kiddos, if I don't put my proper PPE on when I go to suction a kiddo, then I can be possibly exposed and get sick as well. And then I would spread that to my family when I come home. So make sure you wear your PPE. We're terrible about it in the ER. Just be real. But protect yourself, protect your family. That way you don't get sick. And then that way your family doesn't get sick. The big thing too is wash your hands. Wash in, wash out. Wash every time after you do a dirty procedure. That just helps prevent the spreading of the germs using hand sanitizer, soap and water, those kinds of things like that. So just making sure good hand hygiene really helps. And that also helps prevent spreading other viruses and stuff because there's a lot of nasty germs out there. All right, so now what? Now that we know what it is, what do we do? So again, suction. If you get a kiddo that comes into your emergency room and you suspect bronchiolitis and they've got tons and tons of snot, suction them. Even if they don't, even if you're like, I don't know if this is bronchiolitis and they have tons and tons of snot, suction them. It'll help you in the long run. Okay. Get all that stuff out of there. That's just all the gunk in there isn't going to help. And I usually tell parents when they're kind of like, I don't know, I don't feel good suctioning them. And the way I explain it is, how do you feel when you're sick and you have so much snot in there you can't breathe? Right? It sucks. It's miserable. And you can blow your nose as an adult. The babies can't. Nor can the toddlers. Even some elementary school kids can't really blow their nose that well. So make sure that you suction, because that is essentially you blowing their nose for them and getting all that crud out of there. Call RT, your respiratory therapist. They will definitely want to monitor these kids, especially if they're in severe respiratory distress and you're going down the lines of needing higher things like the heated high flow, which I'll talk about in a second. Monitor them. Put them on the minimum on a pulse ox so you can see where their oxygen is at. I live at higher elevations, so we definitely were like, if it's 90%, even 89, 88%, I know that's scary, right? It's for those of you at sea level. I'm at 6,600 feet, right in that area there for elevation. So we don't bat an eye at it if we see 90%. If we start seeing like consistently below 90%, then we'll put them on the oxygen. If they're staying above 90%, we're cool with that. At sea level, for you guys at sea level, closer to there, anything below 92, 93% is where you need to start putting them on oxygen. And the other thing too is if you're just seeing respiratory distress, so you're seeing those retractions, they're working really hard, suction them first, give them a chance to calm down because you just really pissed them off, because nobody likes that, being held down and then getting all this saline and crud and everything being sucked out of your nose. Let them settle down, reassess, and then see if they need the oxygen, and then put the oxygen on if you need it. Usually start them at a low amount. You don't want to blast them with it. Usually start like quarter to half liter, kind of see if that's enough there. Start smaller, you can always increase there. What is HHFNC? That is heated high flow nasal cannula. That's where we put a nasal cannula in, we heat the oxygen, humidify it, and then we can blast it higher at a higher liters per minute there. Your respiratory therapist will be the one that's really helpful for this, unless you've been trained on it. For me, I always grab my respiratory therapist. What I do want to know is what is my FiO2 and what is my liters per minute. That way, because this kid's going to be admitted to the either ICU or to the med-surg unit, depending on how severe they are. So knowing that, there's just like kind of helps you so you can spread that information on for a future report, and also you kind of know if your patient is getting better or getting worse, and you're having to increase the oxygen demands and oxygen needs there. If you do put them onto heat high flow, then they'll need probably more than likely IV therapy. With all that oxygen being shoved into their nose at a higher rate, it puts the kids at an increased risk of aspiration, because they're kind of worked up and amped up, and it's just shoving so much oxygen so quickly that it can cause them to vomit. So we usually put these kids as an MPO status as well. So then we got to make sure that we hydrate them with fluids. Get an IV started, get the IV fluids going, as long as your doctor has ordered that, and follow your protocols for that. That'll help as well. Because the other thing is, when you get the fluids going, that's going to thin out those secretions. Dehydrated babies do not do well with bronchiolitis, because it just gunks up all those secretions, all that mucus and everything, dries it out, and then it's miserable for everybody because you can't get it out. So you want to keep these kiddos hydrated. The other thing is that rest. The rest is best. Just let them rest. Suction every so often. Usually it's about, every kid's a little different. Initially it's about every hour to 2 hours, sometimes a little more frequently, as much as I hate to say that. It honestly depends on how much mucus is coming out. And again, don't forget there's a fine balance of suctioning too much and suctioning too little. You definitely want to do it enough so that way they can breathe, but also not too much that you're going to cause increased inflammatory processes in there and make more secretions. So just let them rest, but also constantly reassessing them to make sure that they don't need it. When these kiddos going home, I usually tell parents suction once before they feed, especially if they're breastfed, because they really can't breathe because they shove their nose against the breast and then they can't breathe at all with all the mucus and everything else. So suction before they feed, whether breast or bottle. Then suction, the other ones that I'll tell them is suction right when they wake up in the morning, and then right before they go to bed. Trust me, you'll like it. Your parents will love you if you tell them suction them before they go to bed. The kiddos will sleep longer, and then the parents will get more rest as well. So that's kind of my guideline. There's really no specific anything, any evidence or anything saying more than that, less than that. It's purely dependent on the patient and how bad they're doing there. So that's what you do. Real quick, the airway, this kind of shows you a little bit what happens. The bronchioles are the lower part of the lungs there, and you can see what the normal bronchiole there is on that side there. And then on the other side, you can see all the mucus there and how easily that can get plugged up there. So again, think about the albuterol. If you open up that airway, where does all that mucus go? It settles down into the lungs, and you got more problems. And then you can't get it, is the problem, until they start coughing it out. And then that's not fun, because then you're chasing it there. So that kind of gives you a little idea of how tiny these airways are. And then you just plug them up with just even the slightest little tiny things, and then you're going to have a whole lot more problems there. So that's what you do for RSV and bronchiolitis in general. We use kind of RSV, bronchiolitis interchangeably, but truly the definition is that RSV is a virus that causes bronchiolitis. Bronchiolitis is a symptom because of the virus. Bronchiolitis essentially stands for, go back to your medical terminology, inflammation of the bronchioles. That's what that is there. So when you have an inflammatory process because of RSV, adenovirus, parainfluenza virus, any of those kind of respiratory viruses, those have the potential to cause bronchiolitis. So although RSV can be scary, so can the other viruses. Adenovirus, parainfluenza, all those other ones can be scary as well, just as scary. They just don't get the media coverage because it's not used as interchangeably as RSV and bronchiolitis are together there. So make sure you suction your kiddos. Rest is best. Those are the things to do for your kids, and treat the fever too. Don't forget the fever. I have forgotten that, and it's bit me in the butt a few times. So make sure that you do that, and these kiddos will do well. Get them the IC if they need it. Call your respiratory therapist. Use your resources. That'll really hopefully help these kiddos do much better, and educate your family as well too. So when you go and tell them that the doc tells them, hey, little Johnny here has RSV, make sure that they know what that fully means there, because they don't always, and they're going to base off of what they've seen in the news or social media and those kinds of things like that. So educating your parents. Hopefully this helps a lot, so that way you can be ready for those kiddos walking through your door with RSV. If you like it, give me a like, subscribe, all those things, give me a thumbs up. If you hate it, please let me know, because I don't like it when things don't work out for you. I'm trying to help you out here. If there's something specific, let me know too, because I can help you out. I got lots and lots of things that I can talk about. It's fun. I enjoy it. Cool. Thanks, guys. Have a wonderful day.